Hi again, YouTube. I realized that in making all these videos and giving you guys some advice about dermatology and medical school and all those things, I never actually got a chance to tell you my story of how I decided to become a dermatologist. Starting off the bat, I actually went to medical school straight from undergrad. And when I started medical school, I really thought that I was going to actually be a pediatric surgeon. I was really excited that I had been assigned randomly to a surgeon, actually the surgery clerkship director in medical school, as my advisor. I really enjoyed my surgery rotation. I certainly wasn't like those students who had to be in the OR, who basically spent every waking moment just dreaming about being back in the operating room. Instead, I found myself really gravitating toward talking to patients and getting to know their stories a little bit. My next rotation ended up being internal medicine, and on the medicine rotation, which I had really not considered as a career at all at that point, I started to connect with my patients on a totally different level. I still remember there was one instance where I was alone in the team room and I had picked up the phone and actually called a patient who had recently been discharged just to check in and see how he was doing. My senior resident at the time walked in and heard me having a conversation with this patient and asked me what I was doing, and after I told him that I was calling to check in on the patient, he kind of stopped, looked at me and said, "You know, Stephen, I know you said you want to be a surgeon, but you should really think about internal medicine. I think you'd be really good at it." And it's funny because I don't even think he remembers that comment that he made, but it really changed my entire career just in that moment. And the reason for that isn't because of something that he did necessarily, it was just that spark that made me think about the possibility of becoming an internist in the future. And so I thought about it a lot more and I realized that I truly loved my medicine rotation. There was something about taking a patient that was so complicated with 14 or 15 problems on their problem list, being able to work through each one systematically and not being scared of anything that walked through the door that I really enjoyed. After my medicine rotation, I actually decided to take a year off and to pursue a master's in public health. And before my MPH, I really thought that I was going to be a cardiologist, specifically an interventional cardiologist. I actually teamed up with some researchers and explored the DASH diet and looked at how the DASH diet might affect your risk of cardiovascular events after adoption. I actually had a really successful research project and ended up being invited to speak at the American Heart Association and met a bunch of great cardiology mentors and really enjoyed my time. But it was actually my then girlfriend and now wife who convinced me to think about dermatology. And I remember going to medical school and thinking to myself, dermatology's not for me. I don't really want to go to medical school just to take care of people's pimples and warts. That's just not what I'm really looking for. I decided to do a dermatology rotation, honestly, to appease my family members, to show them how much I wouldn't like the specialty. And then after doing the rotation for 4 weeks, I found myself loving it. I wasn't convinced and I really still wanted to do medicine and not dermatology, so I actually did a dermatology sub-I just to convince myself that this was definitely the wrong choice. And I just ended up loving it even more. And I still remember the patient that I saw in dermatology that convinced me that this might be a field that I wanted to pursue. It was a patient with a blistering disorder who was admitted to the hospital, and on the inpatient service, the residents saw the patient and immediately knew what the diagnosis was. Started her on prednisone, started her on a steroid-sparing agent, and I actually got to see that patient in follow-up about a month later in clinic. And all of that skin disease had melted away, and she was so happy, so ecstatic that after years of suffering with this disease, no one had any clue as to what it was, let alone how to treat it, now was improving so quickly that she had a new lease on life. And I just remember being so impressed. In addition to that, the attending in that clinic also just struck me as one of the smartest, well-rounded, down-to-earth people who asked me all about the mechanism of action of azathioprine, of mycophenolate mofetil, and taught me so much about immunology in those brief 4 hours that I spent with him that it completely turned me around and gave me a 180 and got me so excited about dermatology. All of a sudden I realized that this was a field that did get to see very complex disease. This was a field that got to take care of patients when their disease had stumped a bunch of other physicians, and now the specialists came in and could really make a huge difference in their quality of life. I realized that this specialty was one where you could really own the entire organ, all the way from diagnosing something like a skin cancer, bringing the patient back to actually remove the skin cancer, and even potentially reading the pathology slides yourself because of the type of training that we get in dermatology residency. That was exciting for me. The idea that I could take care of the whole patient was so exciting. The other thing that I realized was that dermatology is a field that does have a lot of research, but there's still so much room for cutting-edge research to be done in the field, that I didn't feel like it was saturated with researchers, and it was a place where I felt like I could really make a name for myself, and a place where I felt like I could really make a huge impact for my patients, and also patients around the globe if I could find a research project or do something consequential for them through the research. The last thing I'll mention is that I love the idea of being able to teach dermatology, something that's so confusing, so confounding to other physicians. If I could have command of that topic, perhaps I could actually use my interest and my passion for teaching in a great way in terms of spreading knowledge across the house of medicine. That's how I ended up choosing derm. And I remember I was still grappling with that decision about whether to be a dermatologist or whether to go into internal medicine, and I spoke with my dermatology chief resident at the time, who asked me one question, and he just stopped and said, "Stephen, when was the last time you met an unhappy dermatologist?" And that sold me right away. The fact that I could be making a huge impact in my patients' lives, the fact that I could teach all my colleagues this subspecialty knowledge that otherwise is pretty difficult to attain, and the fact that I could be providing cutting-edge research and information to improve the lives of others in the future was all great. But then in addition to that, the fact that I could be happy while doing it and be surrounded by other people that are similarly excited about the field was something that I hadn't really thought about before, and something that really excited me. The problem was that I still loved internal medicine. I still really wanted to take care of the whole patient, be the person that wouldn't turn away a patient if they were too complicated, the person that could really take care of someone from start to finish. That's when I decided to look at residency programs, and I really thought about applying in both internal medicine and dermatology separately to try to figure it out. I had no idea that combined internal medicine and dermatology programs existed until I actually started looking through ERAS. That's when I came across this very unique type of program that trained you in internal medicine and dermatology over the course of 5 years. And I was immediately drawn to that type of training. People often ask me, why did you choose to do combined training when you could have easily done one or the other? And to be honest, I probably could have just done internal medicine or just done dermatology and been perfectly happy. There's something about the synergistic quality of combining internal medicine and dermatology that really excited me. The fact that I could be a dermatologist that could take care of the whole patient from an internal medicine perspective was so exciting. The fact that I could be an internist that had this subspecialty knowledge in dermatology and help contribute to the education of my peers and take care of very complex skin disease when they came to me on the internal medicine service was also equally exciting. And so obviously I ultimately ended up applying and matching into a combined med-derm program and have never looked back since. Since graduating from residency, I actually was told by many people that I should stop practicing internal medicine. I was eventually going to stop anyway. Why not just stop now? It's just going to divert your attention. And to those people, at the time, 5 years ago, I said, you know what? I appreciate your opinion, but this is a decision that I have to make myself. I want to practice both, and so I will practice both. And if I decide not to practice medicine or not to practice dermatology in the future, I want that to be my decision. Now it's been 5 years since graduating. I still practice in both specialties, and I still love practicing both. I can't really see myself doing anything different in the near future. I get so much out of practicing internal medicine that I don't get from dermatology, and I get so much practicing dermatology that I don't get from internal medicine, that getting to dabble in both has really been the best of both worlds for me. So that's my story. That's how I ended up in a combined med-derm program. That's how I ended up working in oncodermatology. That's why now my clinical and research niche is really at the intersection of two fields of cancer and skin, and I couldn't be happier. One other thing to mention is that I found myself at the intersection of these two fields a little bit by chance. I actually thought that I was going to combine my interests in rheumatology and dermatology and practice in a rheum derm type of setting. But instead, when I was looking for a job, there happened to be a vacancy in the lymphoma clinic at my hospital, and then soon thereafter, there happened to be this new opportunity in an immunotherapy toxicity group at my hospital, and I jumped at the chance to be a part of this very innovative new area in dermatology, and that's really what my career has turned into at this point. So if I can bore you with a couple lessons that I think I've learned over the course of my, albeit short career thus far, the things that I would take away from my story. First of all, luck and chance has a lot to do with it. Yes, you can prepare as much as you want, you can work really, really hard, and that's gonna get you really, really far in life. But also realize that at some point, timing makes a difference, luck makes a difference. What I mean by that is I wouldn't be practicing oncodermatology if those career opportunities hadn't opened up when I happened to be looking for jobs at the time. The other piece of advice I give you is listen to your mentors, but not all the time. If I had truly listened to my mentors the entire way, I wouldn't be practicing internal medicine at all right now. I decided that that was something that I needed to do for myself, and that's something that I still love doing to this day. Just realize that your mentors have great advice, but not necessarily the perfect advice for you all the time. The last piece of advice I'd give you is to think about what you want in your career far down the road. Residency training is temporary. It'll be difficult, but it's a finite period of time. So think about what you want in a career. And what I mean by that is, what is your mix? Is your mix going to be 80-20 research clinical? Is your mix going to be 50-50? Is your mix going to be complex dermatology with some general dermatology mixed in? Is your mix going to be mainly internal medicine with a little bit of a different specialty? And this applies across the field. It doesn't have to just be dermatology. And think about the colleagues you want to be surrounded by in the future. While I personally don't think that you should use a stereotypical personality for each specialty as a deciding factor, I do think it's important to think about, in general, what type of people do you want to be surrounded by in the future. I personally don't think choosing a specialty should depend on lifestyle. I think that lifestyle should come second to your true passion. In other words, if you love being in the OR, if you love operating at all hours of the night, then by all means go into surgery. However, lifestyle should be at least something to think about. You should think a little bit about what you want in the future in terms of family life, in terms of kids, in terms of how much time is spent at home versus how much time is actually spent at work. All right, that's my story. I hope it was helpful for perhaps some of you, and that's how I found myself practicing dermatology at the intersection of cancer and skin. If you have any questions for me, please feel free to drop them below. Everyone's path is different. Everyone's gonna figure out a different path to their particular specialty, to dermatology, to something different, and I wish you luck on your own journey, your own path to your specialty of choice. Thanks so much for joining me today. See you later.